You're lying on the ground, fully conscious. No anesthesia, no antibiotics, no sterile room. Someone kneeling over you is about to scrape a hole through your skull, layer by layer, until they can see the surface of your brain. And here's the detail that should genuinely surprise you. You have a real chance of walking away from this. Not a small chance, not a lucky 1 in 100 fluke. In some ancient populations, the odds of surviving this exact operation were better than the odds of surviving a comparable operation in a major European hospital thousands of years later, with metal instruments, formal medical training, and doctors who had actually read anatomy textbooks. It sounds almost too strange to be real. Most of us picture ancient medicine as guesswork at best, herbs, chanting, maybe a bit of luck. The idea that a Stone Age or Bronze Age practitioner could deliberately cut into someone's skull and have that person walk away alive, sometimes for years afterward, runs against almost everything we assume about how primitive early medicine must have been. And yet, the physical evidence for it is sitting in museum collections around the world, in bone, that quite literally cannot lie about what happened to it. The operation is called trepanation, cutting, scraping, or drilling a hole through the skull. And it is, as far as archaeologists can tell, the oldest deliberate surgical procedure in human history. It shows up in burial sites on nearly every continent, performed on men, women, and children, sometimes on the same person more than once in their lifetime. For a long time, nobody could agree on what it actually meant. Were these battle wounds, ritual mutilations performed after death, or something far stranger, actual surgery performed on living, breathing patients? Who survived it? The answer to that question came from bone. When archaeologists first started uncovering skulls with these strange circular holes in the 19th century, the debate was intense. In the 1860s, the American diplomat and antiquarian Ephraim George Squire acquired a skull from Peru with a clear rectangular opening cut into the front of the head. He brought it to Paris and showed it to Paul Broca, one of the leading anatomists in Europe at the time. Broca examined the edges of the wound closely and reached a controversial conclusion. This person hadn't died during the operation. The bone around the opening showed clear evidence of healing. Broca estimated the patient had lived for roughly 2 weeks afterward before eventually dying of something else. Many of his contemporaries were skeptical. It seemed almost unbelievable that people without modern tools or germ theory could perform a procedure that dangerous and have the patient live at all. Then more skulls turned up. A Neolithic burial site in central France produced a whole collection of trepanned skulls, and this time the healing was unmistakable. Not just survival for a couple of weeks, but bone that had been smoothly remodeling for what looked like years. The skepticism started to collapse under the weight of the evidence. Here's how that evidence actually works, because it's more elegant than it sounds. Bone is living tissue. When you cut into it, your body doesn't just leave a raw wound sitting there forever. It begins a slow biological process called osteogenesis, laying down new bone cells around the edges of the injury, smoothing and rounding what was originally a sharp, freshly cut edge. That process takes weeks at minimum and continues for months or years. So when a bioarchaeologist looks at an ancient trepanned skull under a microscope, the edge of the hole tells them almost everything they need to know. A sharp, jagged, unhealed edge means the person died during the operation or very shortly after. A smooth, rounded, remodeled edge means something remarkable. The surgery worked, the wound closed, and the patient kept living. Once researchers started applying that standard systematically, the numbers that came back were staggering. Take Peru, which has produced more trepanned skulls than anywhere else on Earth. Over 800 examples recovered from burial caves and excavation sites across the coast and the Andean highlands. Researchers studying skulls from between 400 and 200 BCE found a survival rate of roughly 40% based on an analysis of 59 skulls from that period. That's already remarkable for something this invasive performed with stone tools. But keep moving forward in time, and the number climbs. Skulls from 1000 to 1400 CE, a sample of 421 individuals, show a survival rate around 53%. And by the time you reach the height of the Inca Empire, between roughly 1400 and 1500 CE, Examination of 160 skulls from that period shows a survival rate between 75 and 83%. Read that progression again. Over roughly 2,000 years, without a single textbook, without germ theory, without knowing what bacteria even were, Andean surgeons more than doubled their success rate at one of the most dangerous procedures a human body can undergo, purely through generations of accumulated transmitted skill. And now here's the comparison that should genuinely unsettle you. Trepanation, or a very close medical relative of it, was still being performed in the 19th century in fully modern European hospitals with metal surgical instruments and physicians who had gone through formal training. The survival rate in the best hospitals of that era for this kind of cranial surgery barely reached 10%. Ancient Incan surgeons working with obsidian and bronze tools, no anesthesia beyond whatever natural substances they had access to, and no understanding of infection at the microbial level, were outperforming them by a wide margin. So what were they actually doing? Bioarchaeologists who've studied the technique closely have identified a few consistent patterns. The most common method wasn't drilling or aggressive cutting. It was scraping, slowly wearing away layer after layer of bone with a sharp tool, constantly checking the depth as they went to avoid puncturing the dura mater, the tough membrane that protects the brain itself. It was slower than cutting or drilling, but it was also the safest, and studies comparing techniques across different ancient sites consistently find that scraping produced the highest survival rates of any method used. Once the disc of bone came loose, it was lifted out, the wound was cleaned, and the scalp was left to heal over the opening. The bone itself typically wasn't replaced, leaving a permanent gap that slowly filled in with new growth over the following months. But skill clearly wasn't distributed evenly across every ancient culture that practiced this. Researchers analyzing Trepaned skulls from Iron Age Switzerland found a startlingly high survival rate of 78%. Compare that to Iron Age Britain during roughly the same era, where the healing rate on excavated skulls closer to just 25. Same basic procedure, similar tools available, wildly different outcomes, which tells you this wasn't some universal instinctive skill every ancient society stumbled into equally. It was a craft. Some practitioners in some regions, in some traditions, were simply far more skilled at it than others, and that skill was clearly being passed down, refined, and improved within specific surgical lineages over time. Why were people doing this in the first place? The honest answer is that ancient trepanation almost certainly wasn't performed for just one reason. In cases where the skull shows clear signs of a prior fracture or trauma near the trepanation site, researchers believe the surgery was a direct medical response, relieving dangerous pressure building up beneath a skull injury, essentially an ancient form of decompression surgery for exactly the kind of swelling that modern neurosurgeons still have to treat after severe head trauma. In other cases where there's no obvious injury at all, the leading theory shifts toward the spiritual. Societies that attributed severe headaches, seizures, or unusual behavior to trapped evil spirits or supernatural forces may have used trepanation as a kind of physical exorcism, opening a route for whatever was causing the affliction to escape. Both explanations can be true at once, even within the same culture. A practice that started as genuine emergency trauma care could easily have absorbed spiritual meaning over generations, becoming both medicine and ritual simultaneously. What's hard to argue with, whatever the motivation, is the level of skill involved. This wasn't guesswork. The rising survival rates in Peru, over 2,000 years, are a direct signature of an actual medical tradition. Testing, observing outcomes, refining a technique, and passing that refined knowledge on to the next generation of practitioners. Exactly the same process that improves surgery today, just without a single written record to formalize. Perhaps the most striking evidence of trust in this tradition comes from skulls that show not one trepanation, but two, or even three, performed at different points across a single person's life, each one healed before the next was made. Surviving the operation once, in a world without anesthesia or antibiotics, would be remarkable enough. Choosing to go through it again and then a third time tells you something about how much confidence these patients placed in whoever was holding the tool. Nobody submits to that kind of procedure repeatedly unless the first attempt genuinely worked, and unless the person performing it had a real demonstrated reputation for getting it right. The archaeological record backing all of this isn't limited to bones either. Cave paintings from the Mesolithic and Neolithic periods found across parts of North Africa and Europe appear to depict the procedure itself, figures with tools pressed against the head of another figure, a detail that lines up with what bioarchaeologists were already piecing together from skeletal remains alone. Two completely different kinds of evidence, one carved into stone by an ancient artist, and one written directly into bone by the body's own healing process, arriving at the same conclusion independently. Modern neurosurgery still, at its core, does something remarkably similar to what these ancient surgeons figured out with stone and bronze tools. A craniotomy, one of the most common procedures in neurosurgery today, involves removing a section of skull to access the brain underneath, treating the opening with far more precision and far better technology, but resting on the exact same basic insight. Sometimes the skull itself is the obstacle standing between an injured brain and the help it needs. The tools changed completely. The instruments got safer, sharper, sterile, but the fundamental idea that a human being could open the skull of another living person, let the body do what it does best, and watch it heal, that idea is a very, very old one. Somewhere, thousands of years before anyone wrote down a single word of anatomy, someone picked up a sharpened stone, pressed it against another person's skull, and got it right often enough that the skill was worth teaching to the next person in line.